First, I had to do the pre-assessment. This is important to make sure the patient hasn't had any caffeine or nicotine for at least the past 30 minutes. This also gives us time to find the proper cuff size, meaning it should cover 40% of the circumference of the upper arm and 80% of the area from the elbow to the shoulder. We also have to make sure the patient rests for at least 5 minutes before the blood pressure assessment begins. To begin, I start by pumping air into the cuff to increase the pressure up to 180 millimeters mercury. And as you can see, she is sitting in the right position. Her arm is resting on the table, her feet are not crossed, and her back is resting. Once the cuff reached the proper pressure, I use the valve that is in the pump to lower the pressure by 2 to 5 millimeters mercury per second. At last, while releasing the pressure of the cuff, I carefully listen to any noise using the stethoscope. The first sound I heard was a clear tapping sound, and this was the marker for the systolic blood pressure. After that, I just heard a couple of heartbeats and then it suddenly went silent. This is where I marked the diastolic blood pressure. Using the sphygmomanometer that she's holding on her hand, I was able to assess her blood pressure as normal. I had to do this 3 times. The first one I got was 126 over 70, second one 120 over 72, and at last 120 over 70. To make sure all measurements were correct, I had to wait 2 minutes in between each trial to let the blood pressure go back to normal.